Welcome to a mini lesson for your nursing exams. See more tips below in the comments. Also, add your thoughts or useful tips below in the comment section. Now, let's get started. Medications. The first type of medication are benzodiazepines. Lorazepam or midazolam can be used to decrease anxiety. Nursing actions. Monitor vital signs. Note that benzodiazepines can cause hypotension and respiratory distress. Remember that the medications have amnesic effects. Monitor for paradoxical effects such as euphoria and rage. The second type of medication are opioids. Morphine sulfate and fentanyl are opioid agents used to treat moderate to severe pain. These medications help alleviate pain. Activation of these receptors produces analgesia, pain relief, respiratory depression, euphoria, sedation, and a decrease in gastrointestinal motility. If the client is receiving mechanical ventilation, the nursing actions and client education can vary. Nursing actions. Use cautiously for clients who have asthma or emphysema due to the risk of respiratory depression. Assess pain every 4 hours. Monitor clients, especially older adults, for manifestations of respiratory depression. If respirations are 12 per minute or less, stop the medication and notify the provider immediately. Monitor vital signs for hypotension and bradypnea. Assess for nausea and vomiting. Assess levels of sedation such as drowsiness and level of consciousness. Monitor for constipation. Encourage fluid intake and activity related to a decrease in gastric motility. Monitor intake and output. Report fluid retention as an adverse effect of opioid medications. Client education. If receiving a fentanyl patch, the initial patch takes several hours to take effect. Short-acting pain medication is administered for breakthrough pain. If there are no fluid restrictions due to other conditions, drink plenty of fluids to prevent constipation. Follow instructions on how to use a patient-controlled analgesia pump if applicable. The client is the only person who should push the medication administration button. Now let's talk about a therapeutic procedure that is done to help alleviate pneumothorax and hemothorax, which is chest tube insertion. In the pleural space, chest tubes are placed to drain fluid, blood or air, re-establish a negative pressure, allow lung expansion, and restore normal intrapleural pressure. Nursing actions. Obtain informed consent, gather supplies, monitor the client's status such as vital signs, SaO2 chest tube drainage. Report abnormalities to the provider and administer pain medications. Continually monitor vital signs and the client's response to the procedure. Monitor chest tube placement, the function of chest drainage system, and dressing. Client education. Teach the patient to do the following. Deep breathe to promote lung expansion. Take rest periods as needed. Use proper hand hygiene to prevent infection. Participate in coughing, deep breathing, and use of incentive spirometry. Obtain immunizations for influenza and pneumonia. Recovery from a pneumothorax or hemothorax can be lengthy. If applicable, consider smoking cessation. Follow up with the provider as instructed and report the following to the provider: upper respiratory infection, fever, cough, difficulty breathing, sharp chest pain. Alright, now before moving on to learn about complications, let's do another practice question. A nurse is reviewing discharge instructions for a client who has COPD and experienced a pneumothorax. Which of the following statements should the nurse include? A. Notify your provider if you experience weakness. B. You should be able to return to work in 1 week. C. You need to wear a mask when in crowded areas. D. Notify your provider if you experience a productive cough. Take a moment to pause the video here if you need to. The correct answer is D. A productive or persistent cough should be reported to the physician. This might signal that the client has a respiratory infection that needs to be treated. Now back to the lesson. Complications. Complications of pneumothorax and hemothorax are decreased cardiac output and respiratory failure. Let's go over decreased cardiac output first. Decreased cardiac output is when the amount of blood pumped by the heart decreases as intrathoracic pressure rises. This causes hypotension to develop. Nursing actions. Administer IV fluids and blood products as prescribed. Monitor heart rate and rhythm. Monitor intake and output of the chest tube drainage. The next complication is respiratory failure, which is inadequate gas exchange due to lung collapse. Nursing actions. Prepare for mechanical ventilation. Continue respiratory assessment. Well, that ends this mini lesson. If you like to review this entire lesson, check out the video listed here. Thanks for watching.